So today I'm going to talk about some practical ways to decrease significant disruptive behavior because we all work with children and adolescents and adults that have disruptive behaviors. And as Joe mentioned, took me a long time to leave home. I was in Santa Barbara, which is a little tiny town, for a really long time. But about a year ago, I moved up to Stanford and now working with a team of people to grow their services for children with autism and related disabilities. So it's nice to be up there. I started really working on the PBS field probably in the 80s with a team of individuals from different universities around the country. At that period, and we spent about 20 years working on research. Before that, there were really no evidence-based ways or very few evidence-based ways to work with the children. So when they had disruptive behaviors, most of the time they got put in timeout. I used to work in the public schools, and they had closets they put the kids in. They put rooms that they emptied out of everything. And it was sort of just assumed that the kids were kind of aberrant and that we needed to punish their disruptive behavior. And we never really thought about it having a function. So some of our research and others in this room actually spent a lot of time really trying to focus on this notion of positive behavior support, where we could work with the individuals that had severe disruptive, aggressive, and even just maybe behaviors like repetitive behaviors that were annoying to teachers and annoying at the job site. And so they couldn't stay in those sites, and really develop interventions that would respect their dignity, improve their behavior, promote their capabilities, really look at what are their strengths, and expand their opportunities and have meaningful outcomes. So if they have a lot of aggressive behavior and maybe 100% of the time, anytime a demand is placed on them, they're aggressive, and you get it down to 80%, it's not that good if they're having it 80% of the time, because that's still going to really be hard for the person that's working with them. So as you know, you're probably familiar with the functional behavior assessment, functional analysis, but there are several things that are often predictors of disruptive behavior. Sometimes requesting to engage in a non-preferred task, demanding situations, academics, change in routines, denied access to preferred items, pain and illness, medication, sometimes in the physical environment, just climate, maybe they're inside a lot. And sometimes you'll see it in one setting, not another, like maybe just at school or just at home. And sometimes maybe just indoors and not outdoors. So really, one of the things I think that's important to think about is when disruptive behavior occurs, everybody kind of panics, like nobody likes being around somebody with disruptive behavior. But the main thing to remember is when disruptive behavior occurs, the first thing is just stay calm and keep everybody safe. And we don't need to worry right then about the treatment program while we're in the middle of a crisis, because when a person's really agitated, they're not in a position to be able to learn. But I think too often the behavior's over, especially if they're low frequency, high intensity, and they don't happen very often. We go, okay, got through that one. Maybe it was a bad day or whatever, but we don't develop a treatment plan. So the most important thing is, no matter if it's infrequent or frequent, don't worry about it right when it's happening. Just remember that we need to develop a treatment plan so we can reduce the likelihood that it'll occur again. And the other thing to remember, and this is something that we've all learned, I think that us older people have all learned, me especially, is that problem behaviors are communicative. It used to be thought that they were just aberrant, or it was the kid was bad or didn't like something or whatever. But now we understand that problem behaviors are communicative, and they're not unique to autism. All kids have behavior problems. In fact, being a mom myself, I know that when kids are little, they only have one way to communicate, and that's crying, right? And so they kind of cry a lot for things for the first year of their lives. And then they start learning words, and we can replace those words and say, oh, sweetie, use your words. And then when they get older, if they don't have those words to replace the problem behavior, they may have a tendency to keep on using that problem behavior. And they keep using it because it's maintained, it's efficient, and it's effective. And I think every parent will say honestly that we know sometimes when our kids are going to have a problem behavior and we avoid those situations, no one likes to see their kids unhappy. So it's human nature to just kind of want your kids to be happy and try to avoid those problem behaviors. And I think Ted Carr also showed in a publication that teachers do the same thing too. They might have a curriculum that's really appropriate for the child at the beginning of the school year, and the child starts hitting their heads when you put out the curriculum. And he showed that when the kids have disruptive behavior, the curriculum can be very different at the end of the year and very easy, a lot easier, because the teachers have kind of been unconsciously punished by the kids for the harder curriculum, make it easier and easier and easier. So I think we're all just, none of us, bottom line, like problem behavior. But it's really important to identify the functions and teach new behaviors to replace those inappropriate behaviors. And I have a lot of methods that I'm going to talk about to reduce problem behaviors, but I wanted to start with that because no matter what you're using to stop temporarily or the problem behavior or to deal with it, it's always important to think about that function. If you don't think about, and I think you'll hear this because I looked at the program, you'll hear it several times throughout the next 2 days, but really always think about that. Why is the child doing that, and how, or why is the adolescent or adult engaging in that problem behavior, and what can we do to replace those problem behaviors? So in your assessment, what we want to do is look and see, are they getting attention? Is there a positive consequence? Are they using the behavior for escape or for avoidance? Oftentimes effective and efficient, and that's why it maintains. And they, when we had our team of working on procedures for positive behavior support, our research team with 5 universities, we also found that when you do the replacement behavior, if it's really labor intensive, the kids are likely to go back to the disruptive behavior, or the adults. So even if it's a nonverbal person and they have to sign like I want a break with 3 signs, they might be more likely to engage in that because it's faster just to hit somebody. But if you just do break, easy sign that's just as quick, then it's more likely to reduce quicker. So think about that. Think about the efficiency of the replacement behavior. And also, one of the things that I don't feel like there's as much research as there should be in this area, and that's how often you have to teach the replacement behavior. So if you have a replacement behavior, let's say the work gets too difficult, and the child's in class, you've taught him to ask for help. So the child screams, and then the teacher comes over and says, "Oh, what do you need to say?" And the child says, "I need help." And you go, "Okay, and then I'll help you." But what's been rewarded for the child has been that whole chain. So the child learns, first I get disruptive, then the teacher comes over, then prompts me to say, "I need help." I say, "I need help," and then I get the help. So we don't want that chain to happen. What we want to do is be able to teach those replacement behaviors at other times of day. So when you can even practice it, like giving the child kind of a hard assignment and say, "Can you ask me for help? Ask me for help," and get right in there. So the child uses that as their first go-to response rather than doing those other inappropriate ones before.